Hi, this is Sarah Roberts, and I'm going to be asking her some questions about how it was to be the infection control nurse when COVID started back in 2020. She works at NHC Maryland Heights. So, Sarah, can you just let me know about what it was like to work as an infection control nurse and an RN during COVID?
I really don't have words to describe it. I think it was just a feeling. It was a feeling of unknown. It was a feeling of um, impeding doom. We didn't know what to expect. I feel like we were in a very tense, anxiety filled situation because we didn't know what to expect. The world didn't know what to expect, and we were comparing what our projected future was going to look like compared to what it was going to look like in a hospital scenario, compared to other nursing homes that were getting hit on the coast before us. Um, but it was just a bag full of emotions. I think it was we were riding a wave, and we never knew when the wave was going to crash and dissipate.
It
Uh,
sounds like it was a pretty tough time.
it was very draining physically. It was draining mentally, and it was draining emotionally. Not just for us, but for our residents that we take care of. It was very draining on each other. It felt like we were just treading water a lot, treading water and waiting for help to arrive, but trying to also be optimistic and positive, so that we didn't give up on each other, and really just trying to stay strong, but internally having this doom like feeling.
When you talk about help arriving, how did the regulatory agencies like Health and Senior Services and CMS and St. Louis County, what kind of help were you receiving from them?
Um, I feel like the help that we were receiving was more direction, but then as soon as we would take that direction and guidance, we were told that we needed to do something different, or the things that we implemented to keep our residents safe and the staff and partners safe. We were told that we couldn't do that, so I feel like that there was a lot of uh, going in circles, that we were told to go one way, and then as soon as we took that turn and went down that road, we were told, no, you're on the wrong path, go back this way. I feel like a lot of focus was put on keeping the hospitals as empty as possible, so that they didn't get overwhelmed while we were being overwhelmed. We had a lot of really great systems in place before the pandemic. We had hand sanitizer installed throughout the building. Our residents were up to date on preventative vaccinations. Our staff, we were working with them to make sure that they were vaccinated with flu every year. And we had, cleaning procedures in place, and systems and checks and balances. And then all of our resources got diverted to the hospital, and our orders weren't being fulfilled. We tried to order things back in January and February in anticipation for the pandemic, and our orders were canceled. Our orders were diverted. When we tried to reach out to local, city, and state different groups for resources, we were told that we were asking for too much, and for the building size that we had, we weren't asking for anything more than what we truly needed, and people looked at us like we were asking for too much, that we were being greedy, that we were being selfish. And we had to explain to them that we have a large amount of residents that we care for. We have a large population of staff that are helping through this, and one box of masks or a gallon of hand sanitizer, or a 10 pack of gowns is not going to be sufficient in a 1 hour period in this building, let alone for us to get it for a week. But then we would have other groups, the fire department, the police department, show up, and they'd be getting cases and truckloads of things. And absolutely, they're first responders, and I totally understand that, but we were directly dealing with very, very critically ill residents, and we were not given appropriate tools or guidance a lot of the time.
Wow, that sounds like a tough time, Sarah.
It was very difficult, but it was inspiring to see what we did on our own to take care of each other. I really compliment the guidance that we had from our director of nursing, our ADON, our administrator, chasing down leads and trying to equip staff and residents the best way they could, out of their own pockets, to make sure that we didn't go without, and that we didn't have to reuse single-use items as much as they were wanting us to, and and not even just supplies, things to keep morale up, snacks for the staff and coffee and sodas and basic things just to make the staff not as scared, and to keep showing up for, at the end of the day, the residents.
So I know a lot has changed. Can you talk to me about the patients and what changes you saw during the pandemic at the beginning, where we were and how we were living with the patients at the beginning and through it, and now where we are now?
Yeah, so absolutely. When I started with NHC roughly 13-14 years ago, the reason why I came to NHC of Maryland Heights was the culture of the building and how much, at the end of the day, was invested in the residents and their happiness, because this is in fact their home. And so we had tons of activities and outings and things that brought the community in to build those relationships between generations, and those were things that we really looked forward to every day. And residents would come out in droves to exercise bingo and dancing with the staff, and the botanical gardens coming, and the residents really were looked forward to the meals and things like that. And then as things progressed and started, things were put into place where the residents couldn't have group dining and they couldn't go to activities, and so we had to change our mindset of being such a very hands-on, heavily focused activity building to smaller or personal activities. And the residents really, you could see in their demeanor, their mood, how they interacted with us, that they were really lonely, and it wasn't just because they couldn't see their families. It was because they missed their new families on other wings, and they couldn't have group dining experiences, that they had to eat in their rooms, and or the staff that they were so used to seeing on a regular basis, because of staffing issues, because of the pandemic, were pulled to other halls. And so you noticed a lot of weight loss, and you noticed a lot of lonely faces, and they didn't engage in conversation as much as they used to. You would walk in and they would have almost like a light up because they hadn't seen people in a really long time. They were worried about the other residents on other halls, when outbreaks would take place, if they were going to be safe. It was just a very dark kind of cloud that hung over the residents' heads, and inadvertently affect the staff too. When residents are sad and upset and worried, the staff is also taking that in and absorbing it like a sponge, and just the morale in general was very low for a very, very long time. So,
well, talking about that, can you also talk about morale and how people are feeling? How did this affect your personal life?
It really affected my personal life. I feel like I have some sort of PTSD now. And I had to walk away, and I didn't want to, but because of my own mental health and my own family, I had to take a year off because I needed to find myself again. I felt like I wanted to live COVID like everyone else was living COVID.
What do you mean by that, Sarah?
I feel like everyone just heard about it on the news, and how the news was portraying it. But at the end of the day, you know, when you're a frontline worker and you're a frontline staff member, and to see it sweep through a building and then get blamed a lot by government entities like we were doing something wrong, when really they don't think they understood the sacrifices we were making, the hours we were putting in. I mean, I was working 90 to 100 hours a pay period with two little kids, and then trying to go home and homeschool my kids because schools weren't open. I was very fortunate to have a spouse and partner through all this, and was very understanding because he knew how much I loved long-term care and these residents. But it's been very, my hair was falling out. I mean, it was a very hard, dark time personally for me, because I feel like we were being held very accountable for things that we had no control over. I mean, we were trying the best we could with the resources we had and the amount of support we had, and I feel like we got a very bad rap, and it was not, no one could have prepared for this, no matter what kind of programs and resources you had in place. No one was prepared for something like this, because unfortunately long-term care is the most regulated but least funded entity of healthcare, and I feel like we were kind of sold down the river on a lot of things.
Well, Sarah, I thank you for your personal sacrifice that you gave. I'm glad that you stood by me during the COVID. You and your family is very appreciated. And I'm glad you're back. Even though it's just one day a week,
I know.
I'm glad that you chose to come back with
do.
us. And thank you for this interview.
Yeah, thank you, Susan.
Thanks.
I appreciate it.